Good morning, everyone. I am Stephanie Norma Ansa, and I am now discussing the 21 nursing problems of Faye Abdellah. So, first, let us know who is Faye Abdellah. So, Faye Abdellah was born on March 13, 1919, and died February 24, 2017. She is a nursing research pioneer who developed the 21 nursing problems. She was born in New York to a father of Algerian and Scottish mother. She was the first nurse officer to rank a two-star, the first nurse and the first woman to serve as a deputy surgeon general. In 1942, she earned a nursing diploma from Fitkin Memorial Hospital School of Nursing, now known as Anmei School of Nursing. And Abdallah considered her greatest accomplishment is being able to play a role in establishing a foundation for nursing research as a science. Her book Patient-Centered Approaches to Nursing emphasized nursing science has elicited change throughout nursing curricula. Abdellah went on to earn three degrees from Columbia University. First is a Bachelor of Science degree in nursing in 1945, a Master of Arts degree in physiology in 1942, and a Doctor of Education degree in 1955. So let us proceed to the introduction of the 21 nursing problems. The nursing problems theory developed by Faye Abdallah is a nursing framework that helps nurses identify addresses clients' health needs by focusing on 21 specific problems in the physical, sociological, and emotional domains. It provides a structured problem solving approach to nursing care, emphasizing a patient centered view to help individuals cope with their health issues and achieve optimal wellness. So, next is the 21 nursing problems is divided into three categories. First is the physical, sociological, and emotional needs of clients. Second is the types of interpersonal relationships between the nurse and the patient. And the third one is the common elements of client care. And the nursing problems is also classified into four classifications. First is the basic to all patient, second is sustainable care needs, and third is remedial care needs, and fourth is restorative care needs. So let us first discuss the basic to all patient care needs. So first is maintaining hygiene and physical comfort. Maintaining hygiene and physical comfort involves regular cleaning and grooming habits like daily bathing, hand washing, brushing teeth, wearing clean clothes, which prevent illness and boost self-confidence. It will also include activities that directly contribute to physical comfort like wearing appropriate breathable clothing, proper foot care, and keeping living spaces clean and clutter-free. So, second is promote optimal activity like exercise, rest, and sleep. Establish a consistent sleep schedule, get daily exercise that isn't too close to bedtime, ensure sufficient daily sunlight exposure, create a relaxing bedtime routine, and make your bedroom a cool, dark, and quiet environment free of distractions. The third one is to promote safety through prevention of accident, injury, or other trauma, and through the prevention of the spread of infection. So that emphasize proactive measures like hygiene, environmental safety, risk assessment, and patient education to prevent harm and illness. So this goal is achieved through strategies such as proper hand washing, implementing fall prevention protocols, controlling infections agents, and creating a secure environment for patients and residents. So the last one to basic needs care for patient is to maintain good body mechanics and prevent or reduce deformity. To maintain good body mechanics and prevent deformities, use proper posture by keeping your spine neutral, bending at the hips and knees, engaging core muscles, and maintaining a wide, stable base of support. So, let's proceed to the sustainable care needs, explained by Miss Amira Alid.
Thank you for explaining the basic needs. Now that we understand the importance of maintaining hygiene, comfort, and safety, let us move on to the next category of Faye Abdellah's 21 nursing problems, which focuses on the body's internal balance and proper function. We have sustainal or sustenance care needs. The sustainal or sustenance care needs focus on maintaining the body's internal processes so that all organs and cells can function normally. In simple terms, this category is about helping the patient's body remain stable and healthy inside by ensuring enough oxygen, nutrition, water, and proper elimination. So, according to Abdellah, these needs include facilitating the maintenance of a supply of oxygen to all body cells or give oxygen when needed. For example, the nurse helps a patient breathe better by giving oxygen through a tube or mask. Number 2, facilitating the maintenance of nutrition of all body cells or make sure that the patient eats healthy food. Number 3, facilitating the maintenance of elimination, or in other words, help the patient go to the bathroom. For example, if the patient can't walk, the nurse helps them use a bedpan or assist them to the toilet. Number 4, facilitating the maintenance of fluid and electrolyte balance, or give water or fluids when the body needs it. For example, the nurse gives water or dextrose to prevent the patient from getting dehydrated. Number 5, recognizing the physiological responses of the body to disease conditions or observe how the body reacts to the sickness. For example, the nurse checks if the patient has fever, fast heartbeat, or pain, signs that the body is fighting illness. Number 6, facilitating the maintenance of regulatory mechanism and functions, or in other words, check if the body systems are working right. For example, the nurse checks the patient blood pressure or blood sugar to make sure everything is normal. For the last, facilitating the maintenance of sensory function, or take care of the patient's senses like eyesight. For example, the nurse helps the patient wear glasses or make sure the room has enough light so they can see properly. This part of the theory reminds us that nursing is not just about comfort and safety, but also about maintaining the body's life-sustaining processes. After understanding the physical and internal body needs the patient, let us now proceed to the next part, which focuses on the emotional and psychological side of nursing care, the remedial care needs. Please explain it to them.
After the sustainable care needs, let us proceed to the remedial care needs. First one is to identify and accept positive and negative expressions, feelings, and reactions. To identify and accept positive and negative feelings and reactions is a key component of Faye Abdallah's theory of nursing problems, which emphasizes understanding the whole patient, including their emotional well being. It involves creating a therapeutic environment where individuals feel safe to express themselves, acknowledging their feelings without judgment, and helping them understand the connection between their emotions and overall health to foster healing. The second one is to identify and accept interrelatedness of emotions and organic illness. To identify and accept the interrelatedness of emotions and organic illness, a healthcare provider should encourage the patient to verbalize their feelings, listen to their emotional expressions, and observe for nonverbal cues. The third one is to facilitate the maintenance of effective verbal and nonverbal communication. To maintain effective communication, practice active listening and awareness of verbal clarity. Think before speaking, use confident and concise language, and be aware of audience perspective. For nonverbal communication, use supportive body language like open posture and appropriate eye contact. Be mindful of your vocal tone and pay attention to the body language of others. The fourth one is to promote the development of productive interpersonal relationship. To promote interpersonal relationship, practice effective communication through active listening and clear expression. Show empathy by understanding others' perspective, build trust and reliability through consistent action, and foster mutual respect and support by valuing others' contributions and boundaries. The fifth one is to facilitate toward achievement of personal spiritual goals. To facilitate progress toward achieving personal spiritual goals, define what is spirituality means to you. Set specific and manageable goals and commit to regular practices that foster connection and reflection. Next one is to create and maintain a therapeutic environment. To create or maintain a therapeutic environment, prioritize physical and emotional safety through a comfortable, clean, and private space, while also fostering trust with clear communication, consistent routine, and non-judgmental attitudes. The last one in remedial care needs is to facilitate awareness of self as an individual with varying physical, emotional, and developmental needs. This problem highlights the importance of understanding and responding to patients' unique needs across different stages of life and health challenges, such as involving parents with pediatric patients to support their emotional and developmental needs during procedures. So, let us proceed to the restorative care needs that will be reported by Miss Amera B. Alid.
Thank you for that explanation about remedial care needs, which highlight the importance of communication, emotions, and interpersonal relationships between nurse and the patient. Now, let us proceed to the final category of Faye Abdellah's 21 nursing problems, the restorative care needs, which focus on helping patients recover and adapt their health limitations. So, the restorative care needs are about helping patients adjust, recover, and live a meaningful life despite their physical or emotional limitations. This category emphasizes the nurse's role in supporting the patient's rehabilitation and acceptance of their current condition. So according to Abdellah, restorative care needs include: number 1, accepting the optimum possible goals in light of physical and emotional limitations, or help the patient accept their condition. For example, The nurse encouraged a stroke patient to do simple movements, if even if they can't move normally yet. Number 2, using community resources as an aid in resolving problems that arise from illness, or use help from the community. For example, the nurse connects the patient to programs like therapy or health centers that can continue helping them recover. Number 3, understanding the role of social problems as a influencing factors in the cause of illness. For example, if the patient is always stressed because of money or family issues, the nurse helps by talking to them or referring them to someone who can help. In short, this category focuses on long-term recovery and adaptation, guiding patients to accept their condition, use available support systems, and regain independence. Now that we have discussed all 4 categories, which is basic, sustainable, remedial, and restorative, we can see how Faye Abdellah's theory covers every aspect of a patient's well-being. To summarize and conclude our report, let's move on to the final part.
Thank you, Ms. Amera Alid, for explaining what is the restorative care needs. And now, let us proceed to the nursing meta-paradigm of Faye Abdellah. First is the person. She described nursing recipients as individuals, although she does not delineate her beliefs or assumptions about the nature of human beings. The second one is health. Health, or the achieving of it, is the purpose of nursing services. Although Abdallah does not define health, but she speaks total health needs and a healthy state of mind and body. Next one is the environment. Society is included in planning for optimum health on local, state, and international levels. However, as Abdallah further delineated her ideas, the focus of nursing services is clearly the individual. Next one, or the last one, is the nursing. Nursing is a helping profession which including doing something to or for the person or providing information to the person. It is a comprehensive service to individuals, to families, and therefore to society. And now, let us proceed to the uses of 21 nursing problems in the nursing process. There are 5 uses of nursing problems. First is assessment phase. The second one is nursing diagnosis. Third one is planning phase. Fourth one is implementation. And the last one is the evaluation. And for the conclusion, Abdallah's theory provides basis for determining and organizing nursing care. The problem also provide a basis for organizing appropriate nursing strategies. As a whole, the theory is intended to guide care or just in the hospital settings but also can be applied to community as well. This theory is mainly focused on the clients and nurses' role in identification and solving problems. And last one is her theory has changed the entire nursing focus from disease to patient-centered approach. That's all, and thank you for listening.